All right, Shannon. So having finished looking at your x-rays, having finished kind of doing your clinical exam, I know you've been coming here for a long time. We really appreciate that. One of the things that we always try to do here in our office is make sure that we stay the most up to date as we can on evidence and knowing what's happening out there in the world of, making sure that you're getting the highest quality evidence out there and that in your treatment. One of the things that we've seen in the last few years and kind of this big news flash that's come through dentistry is this idea of helping patients understand their risk for getting new cavities. We know that some people are at lower risk and some people are at higher risk. And so you heard the hygienist earlier talk a little bit about, hey, we want to have some conversation with you and ask some questions to you about, what your risk might be. So I'd love to maybe just talk with you about where your risk is at. And then as we think through that, what you might be able to do to help you get to that goal of avoiding cavities, avoiding having problems in the future, keeping your teeth long term. So how does all that sound?
Okay, sounds good.
Cool. So I think overall, everything is looking good. I don't see any new cavities. You haven't had a cavity in a long time, which is fantastic. I would say you're probably right in the middle in terms of your risk, somewhere in the moderate level. And that's probably mostly due just to your habit of drinking soda pretty consistently throughout the day. A lot of the other things are really good. Probably just the soda that's kind of putting you at risk for developing some cavities in the future. So how do you feel about that when you kind of hear that?
I guess I didn't realize that was such a risk.
Okay. So you weren't super aware that soda could be causing a problem or putting your
usually
risk
has sugar, but
so that's kind of the one you're avoiding all the other sugars, but
right. Well, I need caffeine somewhere, so
okay,
I get it from my soda.
Gotcha. So when you think about soda and then kind of wanting to avoid cavities in the future and understanding you're at moderate risk, how does that make you feel? What are your thoughts on your soda habit when you put it in that context?
I'd rather not be moderate risk. I'd rather be at a little lower risk because I think I do take pretty good care of my teeth.
Okay. So keeping your teeth healthy is maybe a little bit more important to you than
I think so.
Drinking as many maybe sodas as you are right now.
So if you put it that way.
Okay. So, thinking about then maybe wanting to decrease that risk and maybe avoid drinking soda a little bit, it sounds like, what do you think you could do then to maybe help you, drink a little bit less soda? What might you drink instead or whatever?
I guess I could make an attempt to drink more water.
Okay.
Trying to be healthy.
Okay. Yeah, you're trying to be healthy in a lot of other ways in your life too. And
that would cut calories too, so that would be good.
Okay. So not only for your teeth, but for your whole body.
Exactly.
That affects your systemic health as well. Cool. Okay. So drinking a little bit more water could be helpful for you there. And you feel like you could do that. That's something you feel.
I could probably substitute 1 or 2 sodas for a glass of water.
Okay, great. So you're willing to kind of cut that down by 1 or 2. Awesome. Well, if you want, we're happy to touch base with you next time, check in with you, see how that's going. We can certainly give you lots of high fives if it's going well. If it's not, hey, no judgment. We're here to support you and help you and walk through it with you. So we'd love to maybe touch base with you next time.
Okay.
Does that sound good?
Yeah, thanks.
Perfect. Yeah. I'd love to also maybe just talk about a couple of things that we could do, here as well, other options that you might have as well to help you decrease that risk, because certainly soda is one of those things that, puts you at a little bit higher risk, but some other, preventative things that you could do as well here in the office and at home as well. So,
okay.
Great. Well, I think one of the first things that we could do is put some fluoride on in the office here for you. Normally you've probably had that at a few of your visits, but we can put that on a couple times a year for you when you come in for your exams or your cleanings. And that can help decrease your risk as well. We know from the evidence that can be effective. So how does that feel to you?
That sounds fine.
Cool. We have different flavors, so you can pick which one you like and which one works the best for you.
A soda flavor.
Soda flavor, perfect. I love it. I don't know if we have soda. The other thing that we could maybe do as well, you're using fluoride toothpaste at home, which is great. We have some stronger toothpaste as well, essentially that has even more fluoride in it. And that can really help to, reverse the effects of, the sodas or anything in your diet that might be causing, the starts of cavities and things like that. So if you wanted to, we could help, get you some stronger toothpaste that would be more effective even at fighting those cavities off and make your teeth strong. So how does that sound to you?
So I would just switch out my toothpaste.
Got it. Yeah. Instead of using your regular toothpaste, you could use this twice a day. We have it right up front, something that you could take home today if you want. And you just use it just like your regular toothpaste. You would brush with it, spit it out, and then don't rinse so that residue stays on your teeth as long as possible. So what do you think?
I think I could do that.
Okay, perfect. Well, like I said, we'd be happy to set you up with that at the front. But I think those two things combined, along with your decreased soda intake that you want to achieve, I think we could make some really big progress in helping you decrease that risk and keeping you cavity-free long term.
Sounds great.
Perfect. Well, thanks for chatting with me about it. I really appreciate it.
All right, thanks.
Yeah.